Now, previously we talked about the myths whereby people begin to attribute stroke to the person's sins or from curses from the family, or attribute it that the person has eventually taken poison, or they also attribute it that the person has offended the gods. But science has made us to realize that stroke is a sudden onset neurological deficit, which may either be focal or global or vascular origin, lasting more than 24 hours, leading to death or disability, meaning that it can result from blockage of small vessels of the brain by excessive cholesterol and accumulation of plaques, leading to infarction or death of the blood vessels supplying a particular part of the brain. When this type of thing happens, it means that it's an ischemic stroke. In other instances, because of the increased blood pressures, the vessels begin to expand. Because of that increased blood pressure, there is increased blood flow within the vessels, and that increased blood flow eventually exceeds the capacity of the vessels to accumulate the blood flow. And these vessels, especially the small vessels of the brain, now eventually ruptures and begin to bleed, and this is what results in hemorrhagic stroke. Either of these events can result in affectation of that part of the brain that controls that particular function of the body. If the right part of the brain is affected, the left part of the body eventually manifests that particular symptom. Take for instance, when a person has stroke, one part of the body becomes weak. The person cannot be able to move that particular part of the body, and then it means that that particular part of the brain that supplies that particular part of the body to maintain function is affected, either due to brain infarction or brain death, or due to bleeding of small vessels within the brain. Now, when this happens, that particular part of the arm or the leg now becomes paralyzed.